Welcome to the first virtual NAFB convention. Your session will begin momentarily. Before we begin this session of the first ever virtual NAFB convention, we would like to make a few acknowledgments. Thank you to BASF for sponsoring the virtual convention platform. BASF has been a sponsor of the NAFB for more than 30 years, and we appreciate their continued partnership. Did you know that by attending this session today, you'll receive points with the NAFB Virtual Convention game, brought to you by Anuvia Plant Nutrients? Be sure to check the leaderboard on the site. The top 5 participants will receive gift cards. Before we begin this session, I'd like to remind everyone of a couple of things. Be sure to use the hashtag NAFB20 on all of your social media posts. And the NAFB Foundation auction also continues online. Be sure to utilize the proxy bid system to secure your bids today. We would like to send a big thank you to Corteva for sponsoring the video production of this session. Welcome to the first virtual NAFB convention. Your session will begin momentarily. Before we begin this session of the first ever virtual NAFB convention, we would like to make a few acknowledgments. Thank you to BASF for sponsoring the virtual convention platform. BASF has been a sponsor of the NAFB for more than 30 years, and we appreciate their continued partnership. Did you know that by attending this session today, you'll receive points with the NAFB Virtual Convention game, brought to you by Anuvia Plant Nutrients? Be sure to check the leaderboard on the site. The top 5 participants will receive gift cards. Before we begin this session, I'd like to remind everyone of a couple of things. Be sure to use the hashtag NAFB20 on all of your social media posts. And the NAFB Foundation auction also continues online. Be sure to utilize the proxy bid system to secure your bids today. We would like to send a big thank you to Corteva for sponsoring the video production of this session.
Welcome to this Newsmaker session about the rural opioid crisis. The session is sponsored by Nutrien Premium Fertilizer Technologies. Before we begin, a few acknowledgments. Thanks to BASF for sponsoring the virtual convention platform. BASF has been a sponsor of NAFB events for more than 30 years, and we appreciate their continued partnership. By attending this session today, you'll receive points with the NAFB virtual convention game, brought to you by Anuvia Plant Nutrients. Check out the leaderboard on this site. The top 5 people will be receiving gift cards. Now, here's a message from our sponsor, Nutrien Premium Fertilizer Technologies.
ESN Smart Nitrogen is the only controlled release nitrogen source available in broadacre agriculture. Conventional N sources make nitrogen available immediately. While effective for initial requirements, it may fall short during your crop's most demanding growth stages. Unprotected in the soil, conventional nitrogen is highly susceptible to loss through volatilization, denitrification, and leaching. ESN technology uses a flexible polymer coating to encapsulate a nitrogen granule. The coating protects the N from loss mechanisms, releasing it when the crop needs it most. The membrane allows water to diffuse in, dissolve the N granule, and create a water and urea solution. The granule then releases nitrogen at a predictable rate, controlled by soil temperature. This controlled release process matches nitrogen availability to your crop's growing needs, providing continuous nutrition over the entire growing season.
Thank you to Nutrien for your sponsorship. Before we begin the session, I'd like to remind everyone of a couple of things. Be sure to use the hashtag NAFB20 on all of your social media posts. The NAFB Foundation auction also continues online. Be sure to use the proxy bid system to secure your bids. Finally, thank you to Corteva for sponsoring the video production of this session. Now, let me introduce our speakers. Ray Atkinson is an accredited public relations professional with more than 20 years of experience in strategic communications. He served as the Director of Communications for the American Farm Bureau since July 2016. In this role, he developed strategic communications plans that help Farm Bureau achieve its policy and organizational objectives. Our other speaker today is Connie Gayor, who is originally from Chicago and was a city girl until she married a farmer. Connie is now the co-owner of Gayor Farms based in Monticello, Illinois. She and her husband, John, operate an expansive ag business specializing in corn and soybean production. Connie and John also enjoy raising a herd of boar goats and maintaining a flock of chickens and various waterfowl. In addition to her ag duties, Gayor is also a proud mother of 3 children and founder of Marissa's Purpose Faith, Hope, and Love charity. Connie founded the charity after losing her 20-year-old daughter, Marissa McDuff, in a 2016 to an accidental fentanyl overdose. Since then, Connie and her family have been educating, spreading awareness, and trying to help people struggling with drug or alcohol abuse. As part of her charitable efforts, she provides Narcan training and gives free Narcan to those in need. In her free time, Gayor loves to cook, bake, go for long walks, fish, and spend time with her family and paint with her youngest daughter, Julia. Let's welcome Ray and Connie. Thank you guys for being with us today.
Thank you.
Well, to get us started here, Connie, maybe share a little bit more of your story. Tell us how you got to where you're at today.
So Marissa was raised in a very healthy environment, and she was also involved in our church charities causes. She loved animals. She loved creating new creations. She loved to bake and cook, and she was a very caring and daring and adventurous person. She had a horse named Blake, and she loved to ride. She did 4-H. She would barrel race, and she took first place at the rodeo one year. She was a really strong swimmer, and she was involved in so many clubs and sports. Marissa was a student from Monticello High School, and it was her freshman year. At the age of 14, Marissa was diagnosed with juvenile diabetes. That was the same year that we had to put her horse down, which was a very difficult time for her. She started to develop depression, and I noticed that she started to change her friends, and I could see a change in her behavior. And then she became more depressed, and then Marissa began smoking cigarettes and drinking alcohol and trying to fit in with a different crowd that she normally didn't hang around with. And the alcohol and the diabetes didn't mix. So from there, she started to explore with marijuana and cocaine. And when she was 16, she had threatened us that she was going to drop out of school when she turned 17 because she felt like school was a waste of time. So my husband and I had to make a very, very difficult decision, and we decided to send her to a private school. This private school we sent her to was in Arizona, and it was an all-girls school. It was very therapeutic for her, and she excelled like crazy. She was a straight A student, and she got all straight A's. She graduated a year early from high school because she just had that will. This school was very therapeutic because they incorporated therapy to help them find themselves and also to give them the confidence and understand what they're going through. You know, different kids had different varieties of reasons for being there. And it was very helpful. When Marissa came home from school, she looked at me and she said, "Mom, I figured out my purpose." And I was like, wow, that's great, because I'm still working on mine. And she said, "Mom, my purpose was, I was put on this earth to help people." And I was like, wow, that's great, because so many kids struggle with diabetes, and you would be great helping kids get through this. And she's like, "No, Mom, this is going to be way bigger." So who would have ever thought it would have turned into this? When Marissa started college, she was a year ahead of her peers, and she was doing great. But the group of friends that she found as she was going to college turned into a disaster, because she was out one night with a gentleman that I've never even met, but she overdosed in his car while using cocaine that was laced with fentanyl. And he did take her to the hospital. All he did was drive through the parking lot. They've got him on film, and then he decided he wasn't going to go in. So he took her to a wooded area. He left her there, covered her, and she passed away on her own by herself there. When I got the call that she had passed away, I had no idea what she had passed away from, because she had diabetes and they didn't have a toxicology report for 10 weeks. So once they told me that she passed away from overdose of cocaine fentanyl, I didn't even know what fentanyl was. So I had to do some research. And doing my research, I found out that fentanyl is actually 100 times stronger than heroin. And this is what they're lacing the street drugs with, because it's a cheaper form of an opioid that they can put into like heroin or cocaine or even marijuana they're putting it into right now. And it's so cheap, and it gets people so addicted, and they don't actually measure it. So they just mix it in, and it's 100 times stronger than heroin. So that's why so many overdoses are happening. This is why we're having such an abundance amount of overdoses, is this fentanyl. It's a synthetic opioid. And to give you an example, 3 or 9 little granulars of like sugar could drop a grown man of fentanyl. So that's a very small amount. They're also using carfentanil, which is even stronger. It's an elephant tranquilizer, and they're putting this in street drugs. And kids and people don't realize that this is what they're getting. And unfortunately, those who are already addicted to opioids, they don't care because they just want to get their fix. They just need that to get through the day. They're not getting high from it anymore. So what I try to do now, after learning all of this, the only thing I can do is live Marissa's purpose for her, and that's education. Education, excuse me, give me a minute. So education is, I think, the only way we're going to get through this. Education and prayer, because people don't realize what's being put into these drugs. And now they're vaping, and vaping is going to be the new carrier for these drugs. This is going to be the new way that they're going to be able to use these drugs, because they're already making vape pods with marijuana in them, with different types of drugs already in the pods. So they're already starting to do this. The vaping is, people can use it as a tool to help themselves cut back on cigarettes, I guess, if they're using it the proper way and if they are of age and they know what they're doing. But kids in schools and middle schools, 75% in high schools, 75% of kids are using vapes. 50% in middle schools. I mean, my daughter's in middle school, my youngest, and I brought a speaker through the Piatt County and Macon County and some parts of Champaign County, and he spoke to the kids about vaping. And I had these same kids come to Marissa's Purpose race that I host every year, and they were like, "Thank you for bringing that speaker in, because it really made a difference in my choice." And that's kind of what I'm doing, is I'm trying to educate these kids and parents and anybody that'll listen that this is a very serious subject and we really need to get a control over it. I usually every year I try to have a 5K race. This year we did a 5K race with a 11-mile bike ride, and it was very successful. We had it at Allerton Park in Monticello, and in the meantime we try to educate at this race too and have fun with it. And we did the social distancing and everything, and it was wonderful. We do Narcan training. If somebody needs Narcan, we have it readily available. We give it to them for free because that can save their lives. Narcan is a reversal for opioids. So if somebody is overdosing, it will, if you give them the Narcan, which is either a nasal form or injection, that will reverse the effects of the opioid. It won't hurt them if they're not overdosing on an opioid, but it will definitely save their lives for 45 minutes to an hour, and that'll give you enough time to go to the hospital or get them some care. We also, we've helped 6 people this year get into to find recovery. We don't pay for it, but we give them the resources, and we give them the phone numbers that they need, and try to help them any way we can. We've actually had one of the people that we helped start an NA meeting here in Monticello on his own, and I thought that was very courageous of him. Yeah, is there any questions? I mean, I kind of skipped through a lot, but I just don't want to take up all of your time.
Well, I really do appreciate you sharing the story, and I do have some questions for you. We may save that for the end and transition over to Ray. So thank you so much, Connie, for sharing that story with us. And we'll come back with some questions here as soon as we hear from Ray. Ray, thank you for being a part of this session as well. I wondered if you could speak to how you got connected with Connie and what Farm Bureau is doing more on taking a stance on opioids here.
Sure, thank you. I think, I wanted to say first off, Connie, thank you so much for being on here to let people hear your story. I mean, you said that there's the only two things we can really do is education and prayer. I totally agree, but I think the other one is just people like you telling their stories, because we know that stigma is such a huge barrier to treatment and to even, when people won't even talk about something that's going on that they know they have or struggling with. Then it just contributes so much to the problem. And so it's really courageous of you to come forward and be willing to share your story and be willing to let other folks know, it doesn't have to happen to you. And there's things that, that you've been through that I know you don't want to see other folks go through. So thank you for that. When we became aware of this, I won't say we became aware of this issue, but in 2017, we started working on this issue because we were hearing stories like Connie's and from families and, farm families and rural families. And what we learned through all this is, unfortunately, that these stories are way too common, and that people don't really have an understanding that, when you talk about opioid addiction, people think of heroin addicts in urban, environment, city street or whatever. And actually in rural America, it's a worsening problem, and it's growing faster and has been growing faster in rural America than in urban, in big cities for several years. And, there's a lot of reasons for that. And part of it is, I think, the distance and the availability of treatment and stigma and all these things. So, we started hearing these things, and we started talking with National Farmers Union back in 2017 to see how could we really, what can we do? It's such a huge problem that you just kind of don't know what to do. And at that point, and I think a lot of people were really interested to see that we were sitting down with American Farm Bureau, sitting down with National Farmers Union to talk about an issue like this, because folks that know both organizations know that we aren't always aligned on policy, and we felt this was bigger than either one of our organizations, and it's bigger than policy. We decided we weren't going to focus on policy. We're going to focus on, as Connie was talking about, education, awareness, and trying to do something to address stigma. And so we sat down with Farmers Union in 2017, and we said, well, we know this is a huge problem. We know there's a lot of stigma. We know it's affecting farmers and rural communities in terrible ways, but we wanted to have some data to back that up. We knew all these things anecdotally, but we wanted to know the scope of the problem. So we commissioned a national morning consult research survey to just survey rural adults and farmers, subset of rural adults, obviously, to find out the scope of the problem and what people's awareness was and what they thought were things that were contributing to the problem and what could help. And that's where I think a lot of people, it was very big in the news at that time. You heard the talking point that 3 in 4 farmers had been impacted by opioid abuse, either by knowing someone that had been impacted, or they themselves had been impacted, or a friend or family member. And so that was a huge point to us. I mean, I don't think even, like I said, we knew there was a big problem, but we didn't know how big. And we also asked, people, do you think rural communities are being impacted as much as urban areas? And folks really were unaware of that. They said only 31% knew that rural communities are impacted the most. And also about that same percentage, about a third said that they believed that stigma was a big problem in their local community, and that it was a barrier to solving this problem. So we having all that information, quantifiable information, we started developing the Farm Town Strong campaign, working with National Farmers Union. And so on that, we have a website there, farmtownstrong.org, and I'm sure you all know about. And on there, so one of the things that we found early on is if you're having a crisis or your family member's having a crisis, and you go type in opioid treatment or opioid crisis help, whatever, you get like 800,000 results, and some of them are reputable and some of them are kind of not so reputable. And so we thought what we need is really someplace people can go and just a very user-friendly, simple, not 1,000 things to read, but 3 or 4 things to go for help. And so on that site, there's a overview of our research. There's, for instance, there's a link to the SAMHSA, Substance Abuse and Mental Health Administration treatment locator. So you can go in, say if you live in Des Moines, Iowa, you put in your zip code and it'll pop up all treatment for different kinds of things, whether it's medication assisted treatment or counseling or whatever kind of thing you're looking for. There's information there on drug disposal, including home drug disposal, and also on prevention. And I think that's what we're talking about right now. This is why this is so important, because again, people are really unaware of the problem and the scope. And I think kind of people, because of stigma, think, well, it couldn't happen to me, it just won't happen, and they kind of put it aside and don't want to think about it. So prevention is a really important thing. And I will say, we worked with 4-H and FFA throughout this campaign to get that message out to youth, because that's where it starts. If kids understand, the danger and understand that this is not just kind of parents being negative or whatever kids think, that they understand that there's real dangers here that you can't control. I think that's a real key to that. And they both of those organizations did a lot to helping kids understand. And I'll also say that when kids get these messages, a lot of times the kids will take it back to their parents and their grandparents. They'll say, "Hey, Grandpa, did you know like having those pills from your back surgery sitting in your medicine cabinet? That's probably a bad thing, because if you don't need it, you should dispose of those drugs, and there's safe disposal and things like that." Because, for instance, we know that a lot of opioid overdoses, accidental and otherwise, are from the home medicine cabinet. So, we've done a lot of work. We're really proud of our work with Farmers Union and Farmtown and our Farmtown Strong, and we're really proud of people like Connie that are stepping up to tell their stories, because we know it is not easy.
Well, Ray, thank you for sharing that. And I think now is a good time to open it up for questions. If attendees want to join in for a live Q&A session, they are welcome to do that now. Just raise your hand and we will get those questions answered. In the meantime, I wanted to ask a question of Connie, actually. Ray, you talked a lot about stigma when it comes to opioid overdose and how that remains really strong in rural America. Connie, I wondered if you had some thoughts. How do we continue to normalize the conversation around it? I grew up in a rural area, and we would hear all the time about, challenges with drugs and overdose, but it would always seem like it was a hard topic to cover for parents, because my parents never talked to me about it, hardly.
Yes, it is a difficult topic. I think the conversation is what's needed, though, not just with the kids, but even with, the grandparents and anybody, because like Ray said, a lot of it starts too just from your own medicine cabinet. And I think it's really good to have that conversation going, because that's the only way people are going to feel like they're not being judged and that the stigma is not there. When I first found out that Marissa died from an overdose, I was embarrassed. I was sad. I felt like a bad parent. But you got to get past that because this can happen to anybody. There is no discrimination, no age, no color, no nothing. So everyone needs to be aware of it. I even tell people, if you have any suspicion, even in middle school, start drug testing your kids, because if anything, it gives them an easy out. If you're drug testing them, then they're going to think more than twice about doing something because they know that they're going to be drug tested. And that makes it easier on the kid for peer pressure. Talking to your kids is very important. And I think bringing these speakers into the school has made a huge impact on our community. Like I said, I've got people that just text me because they know that I'm open to them contacting me and me getting them help. I have people who tell other people who I've never even met, and I'm getting them help. If there's somebody out there that needs help, contact me. I will be so happy to give you the help you need. If I can do it, I will.
My next question is open to either of you. How can we, as just human beings, be there for someone who's going through a challenge like this or struggling in this capacity? How can we be good help to them?
You could be a good listener. You don't want to enable them, of course, because that just makes it worse. When they're ready for help, they're going to ask you for it. You can't really force them into it, but just let them know that that door is open, that help's available. This is a disease that is affecting 1 out of 3 households. And you don't want them to feel ashamed or like they've disappointed you if it's a child or whatever. You want to get them the help they need.
Yeah, I would, add to that. You didn't use the word, but when you're saying be a good listener, it's absolutely what it is, and it's letting them know you're not trying to judge them. You're not trying to pass judgment. You're saying, look, it's, I understand, because the stigma is so strong. People don't want to talk about it. I think that's probably part of it. They feel like they're going to be judged if they open up and admit something or, talk about something. So, I think, again, and just having that open ear and being willing to listen and in a non-judgmental way.
Thank you both for taking time to answer a few questions. Is there any closing thoughts you'd like to share as we wrap things up today? Maybe start with Connie.
Well, our motto is knowledge is a powerful tool against drug and alcohol abuse. And I think the earlier you start educating, the better off the child will be in making a better choice. But we do need some treatment centers to start opening up more of them because we've got so many people in need. And now with COVID, it's really become a big struggle because they can only use half of the beds that they typically would use. So typically the people who can't afford treatment are the ones that are kind of pushed aside. And I wish I could help more of them too. But if anybody has a need for help, please feel free, marisaspurpose.org. Contact me.
Ray, is there anything else you'd like to add?
Sure. I just, again, like to, thank you, Connie. Thank Connie for your story. And certainly anybody that's looking for any of the help that I mentioned before, go to farmtownstrong.org, and there's a tab right at the top that says Get Help Now. And it's all the things that we talked about, disposal and treatment and prevention and all those kind of things. So I think it's a very easy to use and simple resource that I'd encourage people to check out.
Thanks so much, Ray and Connie, for being with us today. And thank you all for joining us, everyone that is tuned in. This Newsmaker session has been brought to you by Nutrien Premium Fertilizer Technologies, Thank you for your support to our members and this convention. Have a great day.